Chapter 2.
This is the very first notes that we are taking from chapter 2. So what I suggest that you do is, and Jay, you might want to turn the lights off a little bit so we can see the PowerPoint a little bit better. Make yourself a little chart that looks like this, and make sure that you put the arrows where they are up here, because it is a pattern that we will follow, and we are talking about how are infectious diseases transmitted. Because before you know how to protect yourself, you have to know what you're protecting yourself from and how you can get it. And we are specifically talking about all transmission. And by the way, what does transmission mean? From one thing to another. No matter what it is. But before we can figure out how to protect ourselves, we have to know what we're protecting ourselves from and how we can get it. So, in doing so, there are 4 stages that transmission follows of whatever it is. We are not, listen to me, we are not just talking right here about HIV. We're talking about in general, any kind of pathogen in general. We're going to get to HIV in a few minutes. But right now, we're just talking about any pathogen that could possibly make you sick. Jay?
You said to draw just like that?
Yeah, and there's not much writing in each box, so it does not have to be big.
Is that arrow just supposed to go from the little power?
Yeah, I mean, it's just, you're going in stages 1, 2, 3, and 4.
Oh, it's not like a big thing.
Right. All right, so let's look at what happens in stage 1. Now, we kind of had this discussion last week with stage 1, because the bottom line is, before you can become infected with anything, somebody else or something else that you come in contact with has to be infected. And I kept pushing that point last week with certain people, that if you have not partaken in certain activities, you don't have to worry about that. So unless someone or something that you have come in contact with is infected, you don't have to worry about it. You do not have to worry about it. These things don't just appear out of thin air on your body or in your body. You have to have gotten them from somebody somewhere else or something. Now, when I say someone or something is infected, something.
It could be a bug, like a mosquito.
Okay. What else could it be?
That's it.
Okay.
A needle.
Yes. What else? What? But besides a person, we're talking about a thing.
A tick. Mosquito.
I said bug already.
Well, I'm
Scissors.
being specific.
Scissors?
Yeah.
Actually, it's true. If someone were to cut themselves with the scissors and there's blood on the scissors, and then you pick those scissors up and you get that blood on you, but it would have to be in an open wound, which is, that would be, the chances are slim, but it could, you can't discount the fact that it could happen. Then yes, okay? So there are several ways that could happen. So someone or something is infected. And then stage 2, that infectious pathogen then leaves that person's infected body. So how is it going to leave? It could leave, and that by the way, that pathogen, a pathogen is a virus, a bacteria, a fungus, a parasite. It could be any of those things we're talking about. But the bottom line is that whatever that is, that pathogen has to leave that person's body. Now, it can leave that person's body in lots of ways. How can it leave their body? What ways do things? Vomit? Absolutely. What else? How else can it get out of the body? Any excretions? Mucus? Vaginal? Semen? What else? How else do things get out of the body?
Sweat.
Sweat? True.
What about pee?
Yes. Urine?
I
Feces?
definitely got that question wrong on the test.
Urine, feces, which is the reason that we talk about washing your hands. Huge. Feces is huge, believe it or not. So there are lots of, and blood, obviously, blood. There are lots of ways that these things can leave the body. Can they leave the body any other way? What if something bites you? Sucks your blood. Vampires. Just saying. Unless they're the Cullens. Then stage 3. Okay, so this person has it. It leaves their body. So the obvious thing is that infectious pathogen then reaches your body. So it leaves their body, reaches another person's body, and enters that body. Just because it gets on your... That's a point of having skin, guys. It's your protection. Just because it gets on your regular skin that has no cuts, no open wounds, doesn't mean you're going to get infected. It has to enter that body. Now, there are certain ways that can happen. If it is blood-borne, that means the pathogen lives in the blood. It isn't in the urine. It isn't in the sweat. It could be in vomit. People do vomit blood. Sometimes people cough up blood, unfortunately. So there are other random ways that it happens. It could be airborne. Coughing, sneezing, right? Those are airborne. Also, if they're airborne, they can be on things like forks or cups when you drink after somebody, or pencils that you borrowed from somebody. And there are diseases that are passed as simply as that. And then they can be passed by a vector. What did you write on your vocabulary sheet that a vector is?
Mosquito.
Okay. It is generally some kind of an animal, and you're saying bugs and mosquitoes, but it could be something like a raccoon.
Yeah, rabies.
It's a carrier. Okay, now, when we're talking about carrying diseases, I mean, raccoons carry rabies. Rabies is it is a disease. The same thing. A bite can do it. And by the way, human bites, I don't know if you know this or not, but human bites are many times much more dangerous than animal bites. The human mouth is a nasty place. It really is. I mean, that's just scientifically proven. It's nasty. That's why you need to keep your tongue in your own mouth, not put it down somebody else's mouth. I'm just saying, I see it all the time. And when I do, I tell them straight up, you're going to get a disease like that. And believe it or not, they'll stop for the moment. Okay, so this entering the blood, entering this person's body can be any of these ways. Now, it can be direct or indirect. If it's direct, how's that going to take place?
What was your question?
If it's direct transmission, what is direct transmission? Direct contact with that person's body. Direct contact with that person's body. So let's just face it. There are some diseases that can be passed from kissing. HIV is not one, but there are some. I mean, a simple cold or flu, those kinds of things can be passed by kissing. So yes, herpes absolutely can. And so if it's direct transmission, it's direct transmission. Obviously, sexual intercourse is direct transmission. And then there's indirect. What would indirect transmission? That means you get it from somebody, but you don't get it from touching them. Needles is huge. Vectors is huge. Drinking after somebody, eating after somebody. Those are the kinds of things that are indirect. You don't have to touch their body, but you can still get their disease. So you've got direct, body to body, indirect. There's something in between you and that other person that transmitted it. Okay? And then obviously the last thing, stage 4, is now you or the second person is going to develop that infection. So that's the path that a pathogen, any pathogen takes from one person to another. So once again, when you're worried about contracting a particular disease, you have to know how it's passed and what kind of contact you've had with the first person that has the disease. Okay? Now, go to your yellow sheet, because we are specifically today going to talk about, well, we're really only going to talk about one blood-borne pathogen. So there are only 3 serious blood-borne pathogens that we need to worry about while giving first aid. In other words, we're not worried about somebody coughing on us, sneezing on us, any of that. We're talking about blood to blood. And that would happen in an accident where somebody's bleeding and you may not be protected with gloves or a mask or whatever, and you get their blood on you in an area where there's an open wound or a cut, and you can get it that way. Okay? Now, on your sheet, you've got 3 rows going sideways. In the first row, that little the up and down kinds, put HIV, because we're going across. We're going across. So everything we do today will be going across that chart.
Wait, so that like really, really tiny one?
Yes, the little skinny one. Now yours looks a little different than mine because I don't have that particular box. So today specifically we are talking about the transmission of HIV, because obviously that is the one most people are worried about. There are 2 others that we need to worry about as well, but most of the time people are more worried about HIV than they are hepatitis B and C, and truthfully, equally, you can get them all. It would be equally as common. So you need to be worried about all 3, not just one of them. But today we're going to look at HIV, human immunodeficiency. Immuno refers to what? Immune system, and deficiency means what? You don't have enough of something. So immunodeficient means what? You don't have a strong immune system. Now, we all have a different degree of strength of our immune system. Some people get sick all the time, like every little cold, every little flu, everything that comes along, they're sick all the time. They probably have a very, what we call, suppressed immune system, which means their body just doesn't have enough white blood cells to fight it off. Other people never get sick. They can be exposed to all kinds of flu and colds and whatever, and they just never get sick. They have a strong immune system. Some of it can be genetic. Some of it has to do with diet, because there are certain kinds of vitamins and minerals and things that build up your immune system. And you may be taking those things in, don't even realize it. So whether or not you have a strong or a weak immune system, the only way you would know that would be through some extensive testing of your blood to find out how strong your immune system is. Bottom line is, this particular virus attacks the immune system. And the reason that we cannot I don't want you to see all that stuff. It's all a surprise.
That's what I'm saying. Now I know how many people carry it or are positive.
Pretend you didn't see it, okay? Just
Yeah.
pretend.
It was like...
Okay,
right?
stop. So, because it is a virus, there's nothing to cure it. And because of the way it acts in the immune system, there's no vaccination that we can take to stop the production of the virus once it gets in the body. The sad part about this is, and you would think with all our technology and all the things that we can do, you would think that we could do this. But the HIV virus itself is like out of control. And when you get the virus in the body, it attacks certain cells in the immune system. And what normally those cells, they normally eat up a virus. Like if you got the measles, that virus would eat up the measles. Well, what happens with HIV is when the virus goes to attack that white blood cell, it gets in it and busts open and multiplies, and it's like hatching out a bunch of baby HIVs. Seriously, that is exactly what happens. Instead of that white cell being able to eat it up, the virus gets inside the white cell and it literally hatches out with hundreds more HIV viruses. If they could stop that process, we could get a handle on this. But everything they've tried won't work, which is the reason we can't get a handle on HIV. That one little thing right there. Because it's the only virus that does that. The only virus that multiplies itself inside the very thing that it's supposed to be attacking. It just multiplies. And there's nothing that they've found that can stop it. That's the one thing we need to find. Can't do it. So that's the reason that it eats up our immune system. And it multiplies itself. Multiplies. Now, I will say this. We've got some big-time drugs now that will help, but nothing is stopping it. All right, prevalence. So we're going across. What does prevalence mean? Prevalence is...
Preventing.
No, not preventing. It sounds like that, but that's not what it is.
Awareness.
Prevalence is how much does it occur? How prevalent is it? How much do we see this happening? So, yes, you saw this. 1.7 million people in the United States are infected with HIV. And by the way, just that is updated as of this morning. Like I went on the internet this morning, and that is the number. That's not the scary part. That's not the scary part. We're going to get to the scary part. 1.7 million people are infected. That's just in the U.S., and I didn't even go worldwide. Here's the thing. We probably have less prevalence than the rest of the world. Why?
Because we're cleaner.
What? That's part of it. Why else? More medical science. Why?
We only have one why.
No, that's education. Education. We probably educate more so than other countries do. And there are a lot of third world countries that can't get a handle on this at all. Oh, sorry. Oh, they're HIV positive. Now, here's the scary part. 1 out of 5 people are not aware that they are HIV positive. Now, there are 5 people in your row.
Oh my God. Stop.
There are 5 people in every row.
So you trying to say what am I saying HIV?
I'm saying statistically, having been exposed, that would mean one person in each one of these rows is not even aware that they're HIV positive. Now, you can look at each other and make faces and wonder about each other if you want to, but you need to know in your heart of hearts that if you have not done anything to expose yourself, you don't have anything to worry about. And even if the person next to you were HIV positive, big deal. You going to get it from them sitting next to them?
No.
Unless you're going to have sex with them, share a needle with them, or, you don't even have something to worry about. So, listen, the truth of the matter is, you have no idea who you really have come in contact with who is HIV positive, because you can't look at them and tell. You don't know. So, they're unaware. Here we go. Every 9.5 seconds in the United States, somebody becomes infected with HIV. Yes. Every 9.5 seconds, somebody.
So you're saying every 9.5 seconds someone either having sex, sharing needles, something?
Some way they're becoming infected. Yes.
Well, there's only so many ways to become infected.
That's right.
That's driving.
That's a scary statistic. So you think about how many seconds you're in a class period and figure out...
This class thing.
No, I said how many seconds you're in the class. How many minutes? We're in here, 50 minutes?
Yeah.
However many seconds that is, divided by 9, that's how many people are becoming infected in the period of time that you're sitting in first aid. I'm just saying. So it is prevalent. Now, I will say this. That 1.7 million, I think that statistic is way down from what it was 10 years ago. Considering our population. And the reason I think that is education. Because there was a time when you just did not talk about HIV. You didn't talk about it. Because if you talked about it, you were going to have to talk about sex. And we didn't do that. We just did not do that. So I think that because we have stopped making it taboo and we have started educating people, kids, young adults, everybody, and taught them how to protect themselves and taught them how the virus works, that I think more people, just the awareness. So I do think, though, that is a staggering statistic, but I still think it's less than what it was probably 10 years ago. Because 10 years ago, you heard about it all the time on the news. Every night there was something on the news. You never hear about it on the news anymore, do you? HIV. Unless it's like a medical breakthrough or something. Bottom line. All right, so let's look at transmission. Here we go. How's it transmitted? 4 ways. Blood, semen, vaginal secretions, and breast milk. So I will say it again. If you have not participated in any of those 4 activities, I don't think that you need to worry. No, I don't. It's not I don't think. I know for a fact that you don't have to worry about it. You can't get it from a toilet seat. You can't get it from using somebody's pencil. You can't get it from kissing somebody. You can't get it from sweat, bumping into somebody if they have sweat on them. You can't get it from using someone's towel. Common everyday things that we used to think would spread it, would transmit it, we found out does not. It does not. Now let's talk about vectors. What are vectors?
Things that carry.
Carriers, like animals. Okay? Can mosquitoes transmit HIV?
Yes.
No.
What?
No, no, no. When we first started out understanding HIV, we did believe that because common sense, blood to blood, right? They bite you, they suck some of your blood, they go to somebody else. That blood could be, mixed somehow when they bit somebody else. We have basically found out that it is structurally impossible for a mosquito to carry an HIV virus. And here's the reason. For them to suck up your blood and suck up an HIV virus is about as likely as you sucking a potato through a straw. So what does that tell you? I'm being dead serious. What does that tell you
That's
about
almost impossible.
why? But why?
Potatoes don't go up straws.
Okay? Why?
I mean like the whole potato.
Yes.
With straw,
So
not
why?
with straw.
Why?
It's too big.
It's too big. So what does that tell you then about a mosquito who sucks your blood?
That the HIV thing is too big for
Yes.
it to suck up.
The actual virus itself, the little teeny tiny, as tiny as it is, the little teeny tiny virus,
It's
I don't know,
bigger
their
than a
little mosquito
beak.
sucker thing, I don't know what it is.
It's a beak.
Can't do it. It can suck the blood. And don't misunderstand, there are plenty of other things in blood that are deadly that they can transmit. They can transmit encephalitis.
But don't they suck blood, not put it back in?
But they do. But there's always that chance that it's mixed somehow. There's always that chance. And we know that because we know encephalitis is carried by mosquitoes. And encephalitis is a swelling, an infection of the spinal cord and the nerves in the brain. And it is deadly. Meningitis can be carried as well. So there are some viruses and bacteria that are small enough that a mosquito can suck them up and transmit them. But HIV is not one of them. Fleas, ticks, those kinds of things. The chances of a flea or a tick biting somebody that has HIV and then biting somebody who doesn't, and that happening, that mixture of blood happening, are so slim. I mean, I guess nothing is really and truly impossible, but I've never read or heard anything about that happening. So vectors generally are not going to be transmitters of HIV. This is it, guys. This is it. And again, let me say that blood has to get into your system, not just on your skin.
Alright, so it's a guarantee that even if if they have how people prick their finger?
Yep.
that little amount of blood that gets in you, it's like guaranteed you're getting it?
Absolutely not.
Alright, so it has to be like a good amount of blood?
I can't say that. I can't say how much.
But if you get a little bit in you, it's not guaranteed you're going to get it?
It is not guaranteed. It is not guaranteed. But it's not guaranteed you won't either. Okay? Let's talk about mother to baby. If a mother is HIV positive and she gets pregnant and she gives birth to this baby, will this baby be HIV positive?
No.
Possibly.
50% chance. Because here's what here's what a lot of people don't realize. Mother does not give baby blood. Baby makes its own blood. Mother and baby's blood do not mix. What?
At all?
At all.
So what is the...
What? What are you laughing at?
That's amazing.
Did you think that mothers gave their blood? That mothers provided blood for babies when they're born?
I thought the babies, like, don't they, like, sit in, like, a pool, like red stuff?
Oh.
Ew.
No.
Like,
They're in
like a
water.
sack.
They're in umbilical water.
They're in a sack.
Why are they red?
No, like, why is the liquid red?
It's not red.
Really?
No, it's clear.
They're in a
Like, my
sack of
dog
water.
gave birth to, like, puppies, and it was all red. Because her vagina
Well, you're going. I mean, anytime you give birth, there's going to be some blood, but that's not at all what the baby's in. The baby's is in.
A sack of water.
Yeah.
Oh.
Yeah.
How does the baby not drown now that I think about it?
Okay. Well, we're not. You need to take child development for that.
You can just answer that real quick.
Because they're not breathing in. They're not breathing. They're getting oxygen through the umbilical cord. They're not breathing inside.
Whatsoever. I had to breathe that off for 9 months.
No, you did not breathe that off for 9 months.
Was my heart beating?
Yes.
Isn't that why they slap the baby so it can cry?
Sometimes.
Whoa.
Okay. Okay. But listen. The reason, guys, focus. Okay, 50% chance. There is some possibility that at birth, the mother's and baby's blood may come in contact, and that's probably when that would occur. 50% chance that they'll be born that way, or with HIV, 50% chance that they won't. So, but if the mother was HIV positive, gave birth to a baby who was not, what she could not do then is breastfeed, obviously.
I have a good question. You know how there's blood when the baby comes out and they're all covered in blood?
Sometimes.
That may happen.
Sometimes.
If the baby opens their mouth and some of the blood gets in them, would that cause it or no?
There's not going to be that much blood at a birth. There's not that much.
I feel like when a baby comes out, they're usually red, and they be wiping them off with a towel.
Yeah, that's what I'm
There's
saying.
not that much.
So it takes a lot.
It doesn't.
All right, now
Please.
Now it's gonna sound weird when I say this. So if I just drank a cup of blood, is that a way to get it in my blood?
Possibly yes, because everything that you eat from your stomach and intestines is absorbed into your bloodstream
And it can get
my
under
stomach
your
acid
tongue,
wouldn't
too.
kill it.
and under your tongue. That's what we talked about, putting medicine under the tongue. Remember, because it goes into the bloodstream. Yes. Just don't drink blood, okay?
No,
Just
you were like there's not that much blood. I was just asking.
no. At birth,
In
they,
mouth is the mouth a way to get
chances
it?
are
Yes.
ridiculously slim.
What if
Okay.
you have, like, sores in your mouth?
Sores in your mouth, absolutely. Or where your gum. You know how sometimes you brush your teeth and your gums bleed?
Yes.
Absolutely. Absolutely.
Doesn't that mean you brush too hard?
Or you have to
So we've gone from obstetrics now to dental.
from a mother giving birth to
Wait, I have
Chris, you have a... Hurry.
like,
Is it dental related?
no.
Okay, good.
Nick, if you're kissing somebody and they're for some odd reason they're bleeding in their mouth and they have HIV and I have like a sore in my mouth, could I get HIV?
Yeah, so, like, don't bite somebody's tongue. You know?
I would be looking in your mouth like.
No.
Hey.
Note to self, don't bite their tongue.
Oh, for sure not. Oh, no.
All right, we gotta go. All right, signs and symptoms. Now, we did talk about this before. With HIV, okay, you do realize that there is a difference between being HIV positive and having AIDS. They are not the same thing. This is where a lot of people are misinformed. Remember, and I think I said this the other day, If you are HIV positive, all that means is you have the virus in your bloodstream, and you could be what we call asymptomatic, no symptoms, for how long?
10 years.
Okay, but it might be only 6 weeks before you have symptoms. It could be 6 months, 2 years, 8 years, 10 years.
But it's definitely
There's no way to know when the symptoms may manifest themselves in you. A lot of it depends on your immune system and how strong or weak it might be. So you can go. Now, there are actually 3 stages. There's stage 1, where you're HIV infected. Stage 2, which generally happens within a couple of years, is what we call ARC, AIDS-related complex. And this is where you do start getting some symptoms. And at that point, the symptoms are so mild that you might just brush them off as being the flu, because there are a lot of the symptoms are the same as the flu. You may not go to the doctor. The difference is the flu will eventually, you can take Tylenol, whatever, and go away. This isn't going to go away. So eventually you would end up going to the doctor. Now, when they test you for HIV, they're drawing blood. They're not testing to find the virus in your bloodstream. They're not testing to find the actual HIV virus. What would be an indicator that the virus is in your body?
Low white blood cell count.
You're close.
A high blood cell count.
What is it?
Low white blood cell count.
That's what she just said. I know you didn't hear. Well, yes and no. Not low blood cell count. It is white blood cells, but it's your T. It's a specific. It's the T cell that the HIV attacks, because it's an Because what happens is if there's a pathogen present in your body automatically starts building up antibodies. So you're going to start looking. They're going to test to see if there are antibodies against HIV, because all antibodies are specific to the pathogen that's in your body. That's what happens when you take vaccinations. You get a measles vaccine, then antibodies start building up against the measles virus. So if we test for the antibody. So here's the thing. The way that you know you've transitioned from HIV to AIDS is once they find out that you're HIV positive, every month or however weeks or whatever, they're going to test your blood. They are looking at that T cell count, because that's what the virus attacks. We may start out at about 1,500, which would be like a normal T cell count. But as that virus progresses, that T cell count, every time they test, is going to go down and down and down and down and down. You're going to get sicker and sicker and sicker, and you're going to have less ability to fight off infections. When your T cell count gets down to 200, from 1,500 down to 200, first of all, you're really sick. By this time, you're really sick. At that point, when that T cell count, when they do blood work, 200 or less, you now have AIDS. That's how you differentiate from being HIV positive and AIDS. So don't just say, oh, they got AIDS. No, they don't. They don't have AIDS.
So is AIDS worse or?
AIDS is the last stage, and it is the stage that you won't live very long. Once you get that far, and here's the thing, guys. People do not, this is education, people do not die of AIDS. No one dies of AIDS.
What do you mean?
I know you're looking at me like I'm crazy. No one dies of AIDS.
What do they die of?
What do they die of?
The low T cell count.
What?
Low T cell.
No, Lauren. Not viruses. What?
Oh, I have a question.
Hang on. What? Other illnesses that their body, they die from pneumonia. They die from, there are some specific AIDS-related kinds of cancer that some people get that they die from. But there's no such thing as dying from AIDS. They die from something that they get that their body can't fight, that you and I would normally be able to fight off, and they just can't.
What's the cause of AIDS, though? Is it AIDS brings down the T cells?
It's not because, it's because of AIDS that their immune system can't fight it off. But you can't really say, people do, they say they died of AIDS, but they didn't really. They died of pneumonia, or they had whatever. Yes?
How is Magic Johnson still living there?
He is, and that's a good point.
'Cause he's-
There was a time when we first diagnosed people with HIV that the life expectancy was no more than 2 years. And truly, people did not, I mean, if they lived 2 years, that was huge. We have such incredible medications now that can keep the T, they can't do anything, they can't kill the virus. So their job then is to keep the T cell count up. Because as long as the T cell count is up, you can fight off those things that are going to, right.
But then don't the viruses go into the T cell and then?
So it's a constant battle to keep those T cells up.
So the more
Constant
T
battle.
cells you have, the more HIV viruses you have, right?
Well, the more you have, yes, the more opportunity for the HIV to multiply in them. But the bottom line is if you can keep building the T cells, you're going to have a longer life expectancy. And you're right, now, 20 years. I mean, I think he's had it for...
With white T cells? 'Cause that was
Well,
like
there are
6 grams,
medications and foods that can help build those T cells.
You played with it.
Yes. No.
Okay, so, say, for instance, like you get HIV or whatever, is there like different stages that you can get it? Like, say someone that you get it from has AIDS. Does that, like, do you automatically, like, do you always start at,
You're
like,
just
say
going to get the virus.
1500 and
No,
then you make
you're
your
just
way
going to
down?
get the virus.
Okay.
It doesn't matter what stage they are in. They're just giving you the virus. So it's just going to start from the beginning with you.
So like if they have AIDS and you don't automatically get
No.
AIDS, you just have HIV.
Yes.
Okay.
Yes. Lauren.
Okay, so let's say someone's immune system is super low and they get a vaccination for like measles and their antibodies can't
Fight it off.
Whatever. Could they like actually develop like full blown measles?
That's exactly the reason. You know how people get the flu shot? And then they get the flu, which they're not supposed to? That's exactly what happens. That's exactly what happens. All right, let's finish this really quick. Once they get to AIDS, these are going to be the symptoms of AIDS. They're going to have a loss of appetite and they're going to have a huge weight loss. And I mean huge weight loss. Like they're going to be like waifs, like skin and bones. They can't eat. They can't keep things down. You know, vomiting, can't keep them down. They're going to have a fever. They're going to get skin rashes. Some of this skin rash can actually turn into cancers, which are like big nodules all over them. They are going to have swollen lymph nodes. Your lymph nodes are under your chin right here, under your arms, and in your groin area, because your lymphatic system is where your white blood cells are. And so they're constantly working hard, so they swell and they're sore. You know when you have a sore throat, they always do this under here and you can feel it, it's sore? That's because that's where the white blood cells are pumping out, and these get big from overwork, and that's what happens. So that's why the lymph nodes get swollen. You're going to be extremely tired. You're going to have night sweats. Not night sweats as though, okay, I've been under the covers too much and I kick them off because I'm all hot and sweaty. We're talking drenching night sweats, night after night after night. They dehydrate because of that if they don't hydrate themselves. And they have the inability to fight off any infections that may come their way. Yes?
When, like, you have a fever, doesn't that mean you have an infection?
Generally, yes.
Like, wouldn't their white blood cells count be higher if they had a fever?
Not if something's eating it up all the time. Yeah. All right, when are we out of here?
5 minutes.
Like 4 minutes?
Okay, we can do this. Testing. Now, this is what you need to know. Testing is blood work. Okay? But here is what people don't understand. Let's say, for the sake of reality, you had unprotected sex with somebody. And then you got thinking about it and you get scared, right? So you go to the clinic and you get tested. The first thing they're going to ask you before they test you is, how long ago were you exposed? Well, it's been about 2 weeks. You know what they're going to tell you? Go home and come back in 4 more weeks. Because 2 weeks is not enough time for the antibodies. If you were exposed and you do have the virus in your body, 2 weeks is not enough time for your body to build up antibodies that can be detected in the blood. So it's going to come back negative. After 2 weeks, everybody, it doesn't matter if you have it or not, it's going to come back negative because there's not enough antibodies built up. They're going to tell you to come back in 6 or 12 weeks. Probably 6 weeks first. So let's say you go back in 6 weeks and it comes back negative again, and you go, woo, dodge that bullet. They're going to say, don't get all excited about that. Come back in 12 weeks, we're going to do this again.
Wait, so would it be
Because
6 weeks?
again,
6 weeks?
your body may not have built up enough antibodies that can be detected in the bloodstream. So even if you go back after 12 weeks and it's still negative, and you get all excited, they're going to say, you're not out of the woods yet. You come back in 6 months.
So when
Yes.
do you ever know if you don't have it?
After about 6 months.
If you don't have it after 6 months, you're not gonna
That's
get it.
probably correct.
Why wouldn't you just wait 6 months?
But can you, well, because if it does come back, the earlier you find it, the faster you start treatment, the more that they can build up they can start you on medication. Okay? So here's what I'm saying is, you can't go by the first test, unless you did just wait 6 months, which I don't know why anybody would do. But the bottom line is there are a lot of people who get false hope because they think, now can you imagine all that waiting every day? Waiting, wondering, waiting, wondering, waiting, wondering. All right, 6 months. Prevention, duh. First of all, there are no vaccines. We already know that. Safe first aid, that means wearing gloves, wearing masks, whatever you have to do to keep somebody's blood off of you when you're giving first aid. And we are going to do gloves probably on Friday. Learn how to use them, how to take them off safely so you don't get the blood from your gloves on your body. There's a right and a wrong way to do that. Safe first aid, regular hand washing, and using barriers, and that does include condoms. But just so you know, I don't care. I mean, yes, absolutely condoms, but you need to understand condoms are not 100% effective against HIV. Or any other STD for that matter.
Just go in
There's only
notes.
one way that's completely effective.
Thank you. There is only one way that's completely
Please
in
go in notes.
That does go in your notes section.